Hi, this is Dr. Jerrold Bonn. I'm a psychotherapist who does talk therapy, and I want to talk today about the huge role of medication that medication has come to play in psychiatric treatment, as well as uh, the strong feelings pro and con about medication, and also the concern about side effects of medication, almost hysterical concerns about side effects. The medication has come to play a huge role rather suddenly. About 20 years ago, the serotonin medications came into play, and they initially had astounding effects in shrinking the intensity of symptoms, especially of worry and concern. Worrying about everyday events seemed to just slip away after the medication, whereas in the past they had taken a long psychotherapy to address them. However, as time has gone on, for the amount of people who have benefited from these medications is now perhaps exceeded by the number of people who only are benefited partially, or maybe not at all, or who are very troubled by their encounter with medications. Medications became a big thing because of the initial enthusiasm, and also because it became very convenient for people to do medication therapy instead of psychotherapy. However, there's been a growth of strong feelings against medication because of the failures of many people on these drugs, and because of dissatisfaction with the status of psychiatric treatment today. There are things that these new medications can do and can't do. First of all, they can't create self-esteem. They can't help you to organize your life. They can't make you a mature person. They can't help you to have good and positive relationships. They can't teach you anything about understanding your mind or your body. What they can do, certainly the serotonin medications, can shrink the intimidation that comes from upsetting thoughts. There are other wonderful medications that have rather powerful effects, such as the mood stabilizers, which deal with intense negative moods, even better than the serotonin medications do, as well as medications that help with agitated thinking and a feeling of intense vulnerability in the world. Medications really work best when they are given in tandem with good psychotherapy, supportive psychotherapy, educational psychotherapy, psychotherapy that helps people to deal with their symptoms independently of the medication, in tandem with the use of the medication. Think of two horses pulling a carriage out of a ditch, and very often, well, one of the horses is psychotherapy, understanding, and your own efforts. The other is the medication. And with good psychotherapy, we rely more and more on the therapy and less on the medication. If you don't give any kind of therapy with medication, and you stop the medication, you're right back with the same problems you began with, and that, of course, is a problem. There are real needs to educate what the medication is for, and to monitor problems such as weight gain, and sometimes blood levels are required with certain medications. But basically, medications are safe. No medication is as good as hope for depression. No medication is as good as resolution of conflict and having a hearing for injustice, for problems of anger. No medication is as good as physical activity and daily coping for anxiety. But the medications do play an important role. With regard to side effects, there's a huge problem with people being afraid of side effects of medication. And the biggest there, of course, are real side effects. The weight gain, of course, is there, and and you can have sedation if it's not dosed properly at the right time. But the biggest cause of side effects is the anxiety and panic that people have when they're given these medications. This anxiety can occur, or does occur, when you don't have access to the prescriber. You're very frightened to begin with, you're uncertain about the medication, you get a prescription, and if you start to feel something that is not good, you can very quickly panic if you don't have someone to be in touch with to help you to understand whether these feelings are benign or not, and what to do about them. The to be alone with these medications is a prescription for panic, and most of the complaints about these medications are from people who panic on the medications. These are good medications for anxiety and depression, and they're very safe. They're much safer than street drugs. They're proven safe. But if you do not have someone to guide you through them, they become almost a terror for you, and some people go from medication to medication because they can't sustain themselves. So you need these medications to be used properly with good guidance and support, and with good therapy, the need for the medication gradually tapers off in many, many instances. This is Dr. Jerrold Bonn. Thank you very much. I hope this is helpful.